Audio Jungle.
Hello viewer, you are welcome to Health Issues with Dr. Paul. And today we will continue our series on kidney stones by looking at the treatment options for patients with kidney stones. These options are very, very important. The treatment of kidney stones is very, very important because when you allow your kidney to get damaged, the consequences are very, very huge. So it's better you do the appropriate thing by having the treatment for these kidney stones. And most so, we have very modern ways of handling kidney stones that you finish and you'll be asking yourself, what even happened? I don't have any cuts on my body, I don't have any pains and all the rest of them. So the number one treatment option is water therapy, hydrotherapy for patients with small stones. For patients with small stones, hydrotherapy. You have a medical dissolution therapy where you give drugs for certain stones like cystine stones and uric acid stones that are still very small. I usually put that caveat for small uric acid or cystine stones. Most other stones like calcium phosphate and calcium oxalate stones and the rest of them are not susceptible to this medical therapy, so that you will not be deceived by thinking that any type of stone you have, you just go and start taking certain drugs to, or start going to chemists to have some drugs to get rid of the stones. That does not work. It does not work. So medical dissolution therapy is there. Then we have the open surgical approaches where you give a cut to get to the kidney, but that is becoming very obsolete now in the face of modern technological ways of handling kidney stones. Aside the open surgical approaches, you have what we call minimally invasive approaches. Approaches that you can use without having to cut people open. You have the extracorporeal shockwave, the lithotripsy. We have the endoscopic procedures. In terms of the endoscopic approaches to the management of kidney stones, when we talk about endoscopic approaches, we are talking about treatment approaches we do through natural orifices without having to cut you open. No knife cut, no cut whatsoever on the skin. And this we have different things that we do. One of them, and very, very importantly, is the laser approach, the laser option for the management of kidney stones, and which you can see on this video. This is one of our sessions. So the laser approach, we just dust in the stone is flushed out, and then you are fine, no cuts whatsoever at all. And then you have some other options like the percutaneous nephrolithotomy, where you make a small hole on the side of the body, and through that you get into the kidney and break the stones. You have the laparoscopic and then the robotic surgical approaches as well. So in a nutshell, these services are available with us. You can come to us in our hospital for these services. These services are available with us in Omaya. Thank you very much.